Headphones on?
Welcome, everyone. Thanks for joining us today. This is our second Widex podcast in a series of podcasts on different audiological topics. My name is Craig Spencer. I'm the audiology team lead, and I do field training for key accounts for the Widex brand in Canada. And today our topic is tinnitus. I am joined today by Danny Pinault. Thank you for joining us today, Danny.
I'm thrilled to be here.
Danny is an audiologist with over 25 years of experience working both in private practice and in nonprofit organizations, and he specializes in the management of tinnitus. Problematic tinnitus, I might add. He's also an adjunct professor in the Doctor of Audiology program at A.T. Still University's School of Health Sciences.
You got it.
And I will read this. He teaches two courses. One is called The Theoretical and Clinical Foundations of Tinnitus and Hyperacusis Evaluation and Management. That is a mouthful. He is also teaches the course called The Association Between Age-Related Hearing Loss and Cognitive Decline. And I will finish by adding that he has also served as a research advisor for Health Canada, or I should say Statistics Canada, and has co-authored 3 health reports on hearing-related problems. So today the topic of conversation is tinnitus. It's an introductory session on the topic of tinnitus. We intend to have a series of these. And I think it's important that we start by talking about what a clear definition of tinnitus is. So maybe you can start with that.
Well, first, thank you so much for that amazing introduction. And hey, listen, I'm thrilled to be here today and really grateful for the invitation to your podcast and for the opportunity to talk about tinnitus.
Right.
And share with your audience my insight on such an important hearing health issue. So
for sure.
Thank you for having me.
Yeah, well, we thank you for joining us today.
So tinnitus is the perception of sound in the ears or head in the absence of an external sound source. It is generally classified as either subjective or objective tinnitus. So let's start with subjective tinnitus, as it is the most common type.
Right.
And it accounts for more than 96% of all cases and is generally perceived in both ears. So subjective tinnitus is defined as the perception of a phantom sound, either ringing, buzzing, hissing, you name it.
Right.
And it is generated by the brain. Now, while there's no universal agreement or consensus on the exact neural mechanisms responsible for the development of this phantom sound in the brain, the central gain theory is widely accepted as one of the leading explanations. So according to this theory, and I'm going fast, but we're just going to get this out of the way. According to this theory, damage to the ear results in an elevation in spontaneous firing rates or higher than normal level of neural activity observed in several structures of the central auditory nervous system, such as the dorsal cochlear nucleus, the thalamus, and the auditory cortex.
Okay. And talk a little bit about hearing loss and its relationship with subjective tinnitus.
Yeah, so tinnitus can be influenced or triggered by a range of factors, including exposure to loud noise, aging of the auditory system, ear disorders, injury, traumas, such as Meniere's disease, otosclerosis, viral bacterial infection, chronic health conditions such as diabetes and hypertension, some medications, and of course, head and neck tumors. So all clinicians have encountered at least 1 or 2 patients with a vestibular schwannoma. So yeah, it's important to highlight here that subjective tinnitus and hearing loss often share similar underlying conditions or causes. And it's also accurate to say that subjective tinnitus is almost always experienced alongside some level of hearing loss.
So is there a statistic on that? Like how many people with tinnitus also have hearing loss and vice versa?
Yeah, so approximately 80 to 90% of tinnitus patients experience some level of hearing loss.
Interesting. Now, I've heard patients describe having tinnitus, yet having a normal audiogram. Now, we've just learned about how tinnitus is most commonly associated with having hearing loss, but how does that happen with those normal hearing patients?
Yeah, some tinnitus patients with normal pure tone thresholds on their audiograms might have a loss of synapses or damaged connections between cochlear hair cells and auditory nerve fibers, possibly causing conditions such as hidden hearing loss or cochlear synaptopathy. Now we have research evidence supporting that these conditions might be behind the development of subjective tinnitus, especially among individuals reporting an exposure to loud noise or amplified music prior to the onset of the symptom.
Interesting. So that's the most common type, subjective. You mentioned 96% of cases are subjective tinnitus, but you also mentioned objective tinnitus. I'm hoping you can talk a little bit about that.
Yeah. So objective tinnitus is rare.
Okay.
And it accounts for less than 5 to 4% of all cases, but it's mostly perceived unilaterally in one ear only. Right. So objective tinnitus is defined as the perception of a real sound.
A real sound.
A real sound this time, that originates from within the body. And is caused by anomalies or dysfunction within the vascular, muscular, skeletal, or respiratory system.
Okay.
So pulsatile tinnitus is another term for objective tinnitus and is classified as either pulse synchronous or pulse asynchronous tinnitus.
Okay. So two categories, really.
Two categories of pulsatile tinnitus. So your pulse synchronous tinnitus is usually associated with vascular diseases.
Okay.
Such as stroke, atherosclerosis, irregular blood vessel disorders such as an aneurysm or an arteriovenous malformation, idiopathic intracranial hypertension, and once again, head and neck tumors.
Okay. Right.
And particularly that well-vascularized benign tumors located in the middle ear, known as a glomus tympanicum. The chances of encountering a patient with one of those lesions is rare, but probable.
It can happen.
Right?
Yeah,
probable.
For sure. And then asynchronous?
Yeah, asynchronous tinnitus is usually associated with eustachian tube dysfunction, temporomandibular joint disorders, and your palatal or middle ear myoclonus, which is a fancy word for muscle spasms.
Muscle spasms.
So clinicians often can hear the sound of a asynchronous tinnitus, and it's frequently described as a clicking, fluttering, or popping sound. I certainly have encountered a few patients with clicking sounds related to a myoclonus. Fascinating.
Very fascinating, for sure.
Yeah.
For sure. So now I want to kind of switch gears a little bit and talk a little bit about the survey that you were part of, the Canadian Health Measures Survey. Because it starts to uncover a little bit about how common tinnitus is in general, in Canada specifically. Yeah. And I think that's our viewers would be interested in hearing a little bit about that.
Absolutely. So in 2019, I had the opportunity to participate and co-author a health report on the prevalence of tinnitus in Canada. The research project was a joint effort with epidemiologists at Statistic Canada and some of my previous colleagues at the Canadian Hearing Society. So our goal was to analyze tinnitus-related data obtained or collected from the Canadian Health Measures Survey. It's an ongoing nationwide survey that collects health-related socioeconomics and demographic information across the country, including the Atlantic provinces, completely forgot, Quebec, Ontario, the Prairies, and British Columbia.
And all ages?
All ages, yeah. And it's conducted by primarily by the Department of Statistics Canada and in partnership with Health Canada.
And what did you find?
We found that approximately 9.2 million Canadian adults, or around 37% of the general population, had experienced tinnitus in the past year.
37.
Yeah, let's take a moment to absorb this, right?
Yeah.
The prevalence of tinnitus in Canada surpasses the universally agreed prevalence rate of 15%
Okay.
by more than double.
So, just in terms of like a global context, historical research, it's been widely accepted to be, around 15%, but you saw double that. Any idea why?
Yeah, we were surprised, but we think there's several explanations. First, the tinnitus definition that was used in the Canadian Health Measures survey included several sound descriptors rather than just ringing. So tinnitus was defined as ringing, buzzing, hissing, and roaring. And we think it has probably cast a wider net among the Canadian population and has helped capture a greater number of individuals with tinnitus. We also think that increasing public awareness campaign on tinnitus on social media probably has made Canadians more aware of the symptom and the condition.
Right.
I think it's worth noting that there's epidemiological studies on the prevalence of tinnitus were conducted decades ago. And we propose that maybe people back then didn't have access to information as easily as we do now.
Yeah, they weren't familiar with the term or didn't really know what it was.
But regardless, tinnitus is a prevalent condition in Canada.
Definitely.
And many Canadians are currently seeking hearing care services for symptom management or symptom relief.
Right. Did you see any differences between the younger population and the older population?
I'm glad you asked, because what we noticed is that the prevalence of tinnitus was notably higher among individuals aged 19 to 29, with a prevalence rate of 46%, compared to those aged 30 to 49 and 50 to 70, right? With prevalence rates of 33 to 35%.
So you're saying it was more prevalent in the younger population?
Yes.
Interesting. I guess my mind would have gone to thinking that since hearing loss is more prevalent in the older population, it would have been more prevalent with the older population than the younger. That's very interesting.
And would you volunteer?
Yeah, I mean, I guess the thing that comes to mind for me is the younger population and exposure to noise and sound.
Exactly. An increased usage in audio devices with headphones and earbuds, as well as exposure to loud noise and amplified music at events is usually more common among younger demographics.
Very interesting.
So the other thing we found is that around 7% of Canadians with tinnitus reported the symptom as being bothersome and chronic, and significantly affecting their sleep, mood, and concentration. And that finding was consistent with traditional values, indicating that about 15 to 20% of the general patients, of individuals with tinnitus, will report the symptom as being bothersome and chronic.
Interesting. Okay. Now, I mean, when we think about tinnitus kind of on the surface, people report hearing, like you said earlier, a phantom sound in their ear.
Yeah.
But there's a lot of other things and a lot of other characteristics of individuals that contribute to tinnitus. Am I wrong? In other words, there's kind of this peripheral set of factors, I guess, that can affect the situation.
I would start by defining what bothersome tinnitus means.
Okay.
Right? So bothersome tinnitus refers to a condition that significantly impacts an individual's quality of life and is associated with a range of functional and emotional health complications. And these include, as you know, stress, anxiety, depression, reduced concentration, and work performance, and irritability, and inability to relax, and with all your auditory symptoms, right? Hearing difficulties, challenges in hearing, speech and noise, and reduced sound tolerance, right? So to answer your question is how do people develop negative reactions to the symptom of tinnitus, right? So that's a great question, and it's been, and I would say over the last 30 years or so, several theoretical frameworks have been proposed to answer that exact questions. Now, prominent examples are Dr. Pavel Jastropov's with the neurophysiological model of tinnitus, and Dr. Lawrence McKenna with the cognitive behavioral model of tinnitus. And what these models suggest is that tinnitus annoyance and tinnitus-related distress are primarily the result of negative thoughts and feelings, misconception, worries, misinformation about the symptom.
Right.
And additionally, you add to this the use of ineffective coping strategies to try to alleviate the symptom of tinnitus, along with unanswered questions about tinnitus and its causes, and overall lower level of well-being, all play a role in increasing the stress level.
Right. So I guess when it comes to having conversations with patients about tinnitus, how do you talk about tinnitus and all the factors that contribute to it?
I find the best way to do that is to use the iceberg model of bothersome tinnitus. So would that be okay if I use my illustration here to explain it? Okay. All right. So bothersome tinnitus can be divided into two components, an auditory component and non-auditory component, right? So the tip, or the visible part of the iceberg, represents the auditory component, or the hearing symptoms often associated with tinnitus. And that includes the perception of ringing or buzzing in the ears, hearing difficulty, or trouble understanding speech and noise, and reduced sound tolerance.
In other words, these are the things that are very apparent to the patient.
And that's what patients focus on. And most of our clinicians as well, right? So it's like the tip, or it's the visible part of bothersome tinnitus.
Yeah.
Now the submerged part, or the invisible part of it, represent the non-auditory or the mental health aspect, often associated with bothersome tinnitus.
Right.
So it refers to the often hidden aspect of the patient's emotional or behavioral response to the symptom, right? So it includes your unhelpful thinking styles, such as catastrophizing tinnitus symptoms, or the chronic rumination about tinnitus causes and treatment. Those patients that are scavenging Google for cures, right? And it also includes your maladaptive coping mechanisms that are known as safety-seeking behaviors. So we all have these patients who are chronically monitoring their tinnitus 24/7, and they are avoiding the social setting or excessively using earplugs to minimize their exposure to loud sound. And finally, it's all your undiagnosed or unmanaged pre-existing mental health conditions, such as chronic stress and your anxiety, depression, insomnia, and all of that. So I think clinicians always gain in adopting a more holistic approach with patients right at the initial consultation, and try to capture not only the physical component, but the mental health aspect of it.
So it's not ignoring this mental health portion of the iceberg down here. And in fact, in many cases, it may be drawing attention to those things in a careful way, of course, to raise awareness with the patient that these things are contributing greatly.
Yeah, this is how it goes. Usually patients say, oh yeah, I do this. Yeah, I do that. Yeah. Maybe not the mental health conditions, but, they do recognize themselves.
Yeah.
And, like an illustration often is so much clearer.
Interesting.
Yeah.
So is it safe to say then maybe one of the biggest opportunities for hearing care professionals is to get comfortable and familiar with talking about the bottom part of the iceberg with their patients?
You're correct. 100%. That's what you need to do.
Awesome. Okay. Well, thank you so much. I guess to kind of summarize our session today, I would say that we've learned what tinnitus is, the different forms of it. We've learned about how common it is in Canada, surprisingly more common in the younger population than the older in some ways. And then also the role of these, like you referred to them as mental health conditions, and how they affect a patient's situation with respect to their tinnitus. So we want to thank the audience for joining us today. Thank you again, Danny, for providing all of this wonderful information. We're going to have a series of these podcasts on the subject of tinnitus, so we look forward to you joining us at a future Widex podcast on the same topic. So thanks again. Take care, everybody.